am Michael Mann, the host of Planetary Health First, Mars Next, and I'm super excited. I'm not going to Mars yet, but I'm going to Toronto in October, and I'm going to be there with Randy at Orthogonal, and we're going to be co-hosting, broadcasting some amazing MedTech innovators, VCs all across the board, and Randy will be getting into that. But quickly introduce yourself, Randy.
Hi, Mike. Great to be here. So my name is Randy Horton, Chief Solutions Officer at a company called Orthogonal. We work to improve patient outcomes faster by accelerating the development of basically software as a medical device, connected device systems, and digital therapeutics. So basically all the integration of modern computing, connected computing, smartphones, AI, ML into medical devices to improve patient outcomes.
The best of the best come to the MedTech conference. I want to learn about new technology, meaningful connections.
I think the MedTech conference is a great opportunity to celebrate the industry and the amazing work we do. It's also a great opportunity to network. So many companies are here to partner and learn about what small and mid-sized companies do.
I think the MedTech conference is the single most focused ecosystem for MedTech investors trying to smartly deploy capital. We're all here trying to, frankly, accelerate the flywheel of MedTech innovation.
I think it's up to us to really be a pace setter. We can learn from each other. We can open up the industry a little bit more to help change the trajectory for health for patients.
Health equity is core to what we do at MedTech. We're seeing a large rise of health disparities, especially within the maternal health space, especially within women's health. And so how do we help solve for that? The power that is at this conference, we have the capability to make it happen.
We spent quite a few sessions talking about the post-public health emergencies and the complexity of the supply chain to make sure patients have access to critical devices.
A lot of my clients today are trying to manage through some new technology deployments. There's a lot of talk and buzz around Gen AI and AI in general to actually drive that next wave of innovation.
I think this is an industry that works really, really well together. And the best way to do that is to come and see people face to face. And AdvaMed every year knocks out of the park from that perspective for me.
What we keep.
Well, I don't know about you, Randy, but I'm super pumped.
It's going to be a good conference. It won't be as warm as Anaheim last year. Toronto in October is a little bit different than Southern California. But other than that, it's going to be awesome.
Do you want to tell the audience a little bit about kind of who we are going to be talking with?
Sure. So the MedTech conference is probably the biggest show of the year in our space, and it really brings a wide variety of companies. In our case, we'll mostly be talking to MedTech manufacturers, but a real range of companies, from some of the biggest ones like Bayer, who's very involved with software as a medical device, to companies like Hologic, they're in radiation oncology and are doing some really interesting applications of artificial intelligence to more effectively deliver radiation oncology treatments. We'll be talking to some consumer tech companies, for instance, Aura, the makers of the Aura Ring, who have now been getting FDA approval for various algorithms on top of their devices, and are a really interesting example of what happens when consumer wellness and consumer tech companies that really figure out how to engage people on wellness start to move into the medical space. And then there'll be some interesting earlier stage companies. We'll be talking to Ravana, who's doing some really great work around imaging to guide surgery, particularly around things around spinal surgery. Click Therapeutics, which is really one of the most impressive digital therapeutics companies out there. And I think one of the ones that's really made a lot of traction, never got focused on the hype, kept their heads down, and have been doing a lot of great stuff with basically bringing software-based medical device therapeutics, so software-only treatments, digital therapeutics, but bringing them to market through partnerships with large pharmaceutical companies, which is a great business model that they've been helping crack. And finally, we'll be talking to, like the CEO of Applied VR, which is a virtual reality therapeutics company, Josh Sackman. He's got a lot of thoughts about how we have moved the needle on reimbursement. So if you have new and interesting treatments in this industry that are more digitally reliant, how can you get paid for them? He's going to share sort of his case study from Applied VR, as well as talk about his advocacy work with AdvaMed in terms of moving private payers and government payers into models that will allow these kinds of things to be paid for and recognized for their value.
Awesome. Well, I am super excited because at Planetary Health First, Mars Next, we've had amazing discussions across healthcare with payers, providers, startups, founders, VCs, lots of different panel discussions. We've had healthcare advocates on rare disease, and we feel like MedTech is just such a great intersection of where healthcare can be. So if you're thinking that there's something out there that you have that you're working on and you really would love to share that, or a topic that you'd want to noodle with us, reach out to us. We still have some slots and times, and we're always looking to really create high value content that, people across healthcare can really truly enjoy. So Randy, it's going to be an awesome time, man.
Yeah, no, I'm really excited. I would actually say I think people who approach us with things to talk about sometimes end up being some of the most interesting subjects, because it's something we didn't even know existed, that we can bring. And I think, pound for pound, this is a fantastic conference. It's 3,000 people or so you get a really good breadth and depth. But it's not 12,000. It's not a zoo. It's not 24,000. So you can really get a lot done. And what we're going to really try to do here is capture some of the best ideas that are coming up and bring it to your audience. So if you're in MedTech, it's a good way to keep abreast of what's going on. And if you're in healthcare but not MedTech, it's actually we're going to try to make this a really good way for you to catch up on what's happening in this sector, which is so crucial to the space. But I think for a lot of people in other areas of healthcare, medical devices sort of exist, but they don't really think about them a lot. But the impact is huge.
Yeah, absolutely. Well, we are excited. Until next time, we will have to see you in Toronto.
Sounds good. See you in Toronto.